All right, guys, so now we're going to work on thoracic spine. Here to here, pretty much wherever your ribs are attaching to, that's what we're working on. Now remember when we did our mobility, stability type examples, thoracic spine should have tons of mobility. A lot of times if you're sitting at a computer, it's pretty locked up. And that becomes a problem for the shoulder, the neck, and lower back. So we're focusing on here first so that helps everything else. So the first thing you're gonna grab is your good old foam roller. Go ahead. I personally like to sit there and get the T-spine mobility, kind of like what we did last time, just trying to get that thoracic spine extension. But since you've already worked on this, hopefully you've done it every single time, now we're going to work on the rhomboid. So you're going to kind of bring your arms, you're trying to get that shoulder blade out of the way, pick the butt up on off the ground, hit those muscles in between there. There again, we want to do either about a 10 or a 20, okay? Doc likes to say, hey, if it's pretty tender, you should probably do it more. 20 passes back and forth, okay? So you see how he tilted to one side? That's because he's getting one side of that shoulder blade. He tilts this way, guess what? He's getting his left side of the shoulder blade. Okay, now you can actually go and kind of roll, and if you have that little knot, since that kind of initial pain is kind of gone and subsided, now you're scanning that tissue, stop on that area, let it sit there, let it hurt. If you need to move that arm around a little bit, kind of pin and stretch technique, that's okay too. Honestly, the more you do it, the better off this is gonna be. So this is the rhomboids on the inside edge of that shoulder blade. Now he's going to hit his lats. He's gonna take arm over the top of the head. He's gonna hit pretty much from his armpit all the way down to the side. It actually attaches to the lower back. So it's a tough one. We're not gonna hit that whole area because honestly, you foam roll the side of the ribs here. You get down to these lower two, they float. It's not a good thing. You don't wanna break those floating ribs. But he has his knees kind of bent. He's gonna kind of push and pull his way up that foam roller. Go ahead and let you know, this is like the IT band. There's a lot of weight getting put into that side. It's tender, it hurts. So go slow if you need to. If you need there again to stop, like if he's scanning and he's got that knot, hold that pressure, breathe, move that tissue around. So remember, like we talked about last time, breathing is a reset button. It hurts, breathe, relax, because your body's gonna naturally think of, hey, that daggum thing hurts, I'm gonna hold my breath and tense up. This is not the purpose of this one, okay? So you see how he's actually kind of getting in a little bit of a nuance of like a teres minor, teres major, where he's kind of digging in that internal external rotation. That's okay. The beautiful thing about the foam roller, you roll, if it hurts, stop, work on it, okay? And now we're sitting there, we're gonna go continue forward, so we hit the middle part of the shoulder blade, side part of the shoulder blade. Now we're gonna hit the front part. We're gonna hit your pec. So Doc put his thumb down, so he's internally rotating that shoulder, and now he's just gonna roll from pretty much the bicep, front shoulder, to that small area in the pec. Now, you want more weight, you want, whenever especially you go over, the weight is over the foam roll. So he has good amount of weight here, okay? Just try to breathe through this. Sometimes, especially with foam roller, this is one we do not do a lot. We pretty much ignore this. Now, if you want to just really get the front part of the shoulder, and that's it, he's going to put his hand on the small of his back, and it's just a very small movement just on that front part of that shoulder. If you have bicep tendonitis, you will feel this. If you have just trouble internally rotating your arm, getting your arm to scratch your back, or ladies putting on your bra, this is one you can sit there and work on. We're going to hammer this down later, but this is good to kind of prime that movement, okay? So remember, we hit the mid-back, we hit the inside part of that shoulder blade, your rhomboid, then we came over here and hit the lat, and then now he's in the front part to hit that pec, okay? Are you ready? Okay, so remember, we're doing a concept called MSA. M is for your myofascial release, foam roller, lacrosse ball, something to dig into that tissue. S is the stretches, A is for activation. Stretch is what we're gonna do now, okay? So for here, we're gonna still work on that thoracic spine. We're gonna bring his knees nice and high. You can take the foam roller, put it in between your knees. You can angle it just like this, whatever you want. The higher your knees are, the more it locks out the lumbar spine. So this is really strictly just a thoracic spine rotation. He has his hands palm to palm. He's going to rotate as far as he can. This is an open book. He's going to breathe out. His eyes follow his hands, okay? Good. Just work on the breathing. Good. Now sometimes if you're really tight here, then honestly, I just tell people to take a nice deep breath, try to push through it a little bit further. He's taking the shoulder out of the equation. So say sometimes like it hurts too much, it kind of pinches on that front shoulder, which a lot of times if you already have that bicipital tendonitis, the impingement syndrome, this will cause problems. So he did a modified version of putting it into the back of the head. We're gonna show you another modified version because I have a lot of ladies that will put their arms and their shoulders really good, but their thoracic spine didn't do anything. So he's going to hook his ribs, kind of tuck his elbow kind of close to the side, and when he rotates, he is pulling those ribs. And then now he's like, ooh, I can't really get it there. That's what you want to do. Now, kind of have a little bit of an extra caveat when he gets here. He's gonna kind of stiffen up and then breathe out and see if he can go further. There he goes. Then what I want him to do is to kind of resist here and try to rotate back against it. Good. And then let it all out. What that does is adds a little bit of extra rotation to it, okay? And then if you want to clean out the movement, he can go back to his regular, normal, open book move and see if it improved. Good. Now, here's another little thing. Sometimes your hips, this is my problem. My hips are really stiff. When you rotate, that leg will want to start to kind of come this way. Don't let it. Sometimes you need to have something here to kind of hold you there and see how it kind of took a little bit of the rotation here. A little cheat. It's okay. You're focused so much on the thoracic spine, you're not paying attention here. So you either squeeze that foam roller as hard as you can, or think of this top knee pushing to the wall, and it's like, oh, now I can feel the tightness here. That's okay. We were so focused on thoracic spine, but we're gonna tackle this next time. But I want you to focus on that. Good. So, need a bed, couch, platform, bench, whatever you need just to kind of give you a little bit of elevation. We're gonna kind of work one arm at a time. We're gonna hit the lat up. So remember, we got it kind of right around the shoulder, all the way down to that side of the ribs. So what he's gonna do, he's gonna have his arm, he's gonna have it kind of more of an internal rotation here. There you go, thumb down, and he's gonna try to, if he can, shift his weight down and over where he should feel a nice stretch right through this area. Sometimes it's good to just breathe this one out, okay? And then he can switch his hand position to go the other way. So he's moving the ball and socket joint of the shoulder to get a different tension in that lat. Some people have really tight one way. This one's kind of tight for me personally, but he loves this one. Okay, then you do the other side. Good. Remember, breathe. Nice deep breath. Breathing is your reset button. Good. How long should you hold it for?
15 seconds.
There you go. Now it's external rotation. You see how I brought a little bit of a different tension here in the shoulder? That's okay. The muscle's attaching here all the way down. Okay, now that we did one arm at a time, now what we're gonna do is kind of do two. We're gonna pair up a little bit of thoracic spine extension with a little bit of a lat stretch. So what he's gonna do, this is called a prayer stretch. What you're gonna do, he's gonna put your elbows here, and what he's trying to do is focus on this part here to drop down. Now, what we're doing is it's getting a lat stretch here. It's even getting a little bit of a tricep stretch here also. So when we did that shoulder exam on you, and we had you, hey, can you come over and touch that other shoulder blade? Some people can't even get it, their head goes forward. This is really trying to hone in that movement pattern. Now, what he's going to do, we're gonna make this a little bit of the activation part of it instead of just a stretch, is his elbows, he's gonna try to keep his spine here, but he's gonna drive his elbows, almost like he's doing a crunch with his knees, but really focusing on the arms. And then whenever he's done, after controlling it for about 10, 15 seconds, relax, and then he's able to drop down further. And now he's gonna push down again. Good. And then relax. He's able to get a little bit more thoracic spine and lat movement. Now to add a little caveat to it, we wanna see if he can hold this position for a good 10 seconds. So now he's gonna try to keep his spine there if he can and just lift off. Good. 3, 4, 5, 6, 7, 8, 9, and 10. Good. So now you're honing in that movement that he just worked hard with the foam roller, the lat stretch, and the prayer stretch.